Thank you, Mr. Chairman. Thank you for the witnesses for being here. Mr. Massa, we've heard a lot during this hearing about some of the deeply concerning and frankly unacceptable incidents that have taken place over the last few years, particularly involving Network for Hope. I hope your presence on the panel today is an indication of Network for Hope's acknowledgement of previous shortcomings and your willingness to work together to improve our organ donation systems for both patients and OPOs. In addition to addressing the pattern of high-risk DCD procurement practices, HRSA's corrective action plan notes that the OPTN within 180 days is to propose a requirement for the OPTN to be informed of any requested or triggered pause in procurement efforts if there is a concern for unrecognized neurological improvement or potential for a patient to experience pain in the act of procuring organs. It notes that these pauses will be reviewed during monthly meetings. Mr. Massa, has Network for Hope implemented its own protocols to pause procurement in these cases currently?
First of all, thank you for your questions and your comments. We have. We do have established huddles and hard stops during the donation process, especially with DCD donors, to make sure that we get everybody on the healthcare team together, everybody involved in that DCD donor. If there's any concerns, they could address them at that time. There are multiple huddles during that process.
Were those protocols in place before the HRSA report came out and their recommendations? Were those protocols in place?
They were.
And why were they not followed?
The huddles were followed. Yes, they were.
It's clear that in many cases they were not followed. Especially because I know you mentioned that the whistleblower who was allegedly not retaliated against spoke of at least one instance where the doctor suggested that the procedure stop. Has Network
Those were put in place, just to correct, those were put in place after the merger.
Thank you. Why did Network for Hope not document drug overdose as the mechanism of death in nearly 75% of the cases reviewed by HRSA with evidence of patient drug intoxication?
We saw that same report, and we are looking at all those, and we have boosted our documentation process. We have additional training on documentation.
The question, Mr. Massa, is why were those not documented?
Those happened prior to the merger. I can't really speak to that, but since the merger, I can tell you our policy is more robust as it comes to documentation.
HRSA points out in their corrective action plan that this suggests that there's a systemic concern regarding the treatment of potential DCD donors by KYDA staff. How do you explain that?
Again, I can only address the things that occurred post-merger.
What date was the merger, Mr. Massa?
Pardon me?
When was the merger?
October 1st of 2024. And
was the merger a result of this whistleblower's and the findings from this committee? Was it a result of that?
Not at all.
It just followed that.
I think
September 11th, 2024 was the hearing.
Yes, correct.
It followed that, but it wasn't a result of that.
No, ma'am.
Given that at least 98 or 30% nearly of the cases investigated in the HRSA report involved patients who were intoxicated with opioids, amphetamines, or cocaine, are there or should there be any special protocols in place for when a patient is intoxicated?
Absolutely, and we have those policies in place now, and we are going to abide by everything that the HRSA recommended in their letter.
Can you understand, Mr. Massa, the concern that we have for the public, given the fact that the organizations seem to be, and maybe this is not the case, but they seem to be taking advantage of vulnerable families during their most difficult time? The HRSA report indicated a troubling lack of care and concern for patients who are potentially intoxicated by overdose, as if their lives are less than.
That is never the case, and yes, we do find those alarming. And we, as I mentioned, I can't do anything about what happened prior to the merger. I can post-merger, and I can tell you those things are going to be rectified.
Thank you very much. I hope today's hearing will bring clarity on how the failures have happened, what steps need to be taken place with HRSA, OPTN, the contractors, so that we can ensure that these incidents never happen again. I thank you for your testimony today.
Thank you.
I yield back.